Hey guys, Dr. Darren Grollo here again, chiropractor, Bolton, Ontario. Wanted to take a second here and explain a little bit more about what something called canal stenosis is. Now, I don't know if you've ever been told maybe you have canal stenosis or if you know someone who has canal stenosis, but the term can be a little confusing, so let's just take a second and understand a little bit more about what it is we're actually talking about. Now, you guys know that we have your spine, and down through the spine, the brain is going to be sending your spinal cord where it's going to branch off the separate nerves at every level. If we take a cross-section of that spinal canal, this is what it's going to look like. So we've got your spinal cord passing down, the nerves coming out at each level, and it's basically an opening that creates this canal or tunnel that the cord passes through. What can happen is that the size of that opening can become smaller and smaller. This can happen for different reasons. One of them being maybe some calcium begins to build up on the inside, a form of arthritis. But anything that creates a narrowing of that size of the canal is going to be putting pressure directly on the spinal cord itself. It can be incredibly debilitating. The type of symptoms that you could experience from this, though, can actually have a very wide range. Could be from just localized discomfort to complete immobility. It can really vary greatly from person to person. But if you understand what we're talking about with that opening getting smaller, almost like if you've heard of someone that has arteries, occlusion of the arteries, where the fat builds up on the inside and then the blood flow, it doesn't have enough room to actually pass through the arteries. Similar in that regard, where the size of the opening becomes smaller, only this time instead of the blood having to pass through, it's the actual spinal cord itself. So hopefully that makes a little bit more sense. You understand now what canal stenosis is. Now, if this is something that you've got, obviously, check out with your doctor, talk to them about what kinds of things you can do to try and help yourself. If you have any questions at all, please feel free, leave them in the comments section below the video here. I'll do my best to get back to you as quickly as I can. So thanks very much for watching the video. Take care. I'll talk to you soon.